So let's move on to case 6. So we have a case of a female newborn. That female, she's having a severe indirect hyperbilirubinemia. Just put red lines تحت كلمة hyperbilirubinemia. Jaundice or neonatal jaundice, neonatal hyperbilirubinemia is an essential topic in pediatrics. If you don't know how to approach hyperbilirubinemia, you don't know how to know the cause or identify a pathological red flag, very dangerous causes of jaundice in a neonate, you will fail pediatrics. It's a very essential topic. It's a very essential topic. You should look it up, you should know it. That a neonate was born at the 38 weeks of gestation, so she is a full term. ما في remarkable prenatal history. الأبكار score is normal. So she had an أبكار score طبيعية. Normal prenatal history. المشكلة هنا الأساسية عندنا severe indirect hyperbilirubinemia. unconjugated type. طبعا ليش يهمنا نحن unconjugated؟ ليش يهمنا indirect؟ لأنه هذا النوع من البيليروبين is toxic to the brain. It can cross the blood-brain barrier and it can lead to kernicterus, which is a very bad type of encephalopathy caused by bilirubin. الother type of bilirubin هو الconjugated أو الdirect ما يأثر على البرين بهذه الطريقة، فقط indirect. فthat's why we have to be very alert لما يكون عندنا هذا النوع من الهايبربيليروبينيميا. she's normal. ما عندها غير right hand polydactyly. ممكن غالبا هذه polydactyly it's something isolated anomaly. It can be part of another diseases. Her parents are healthy. They are consanguineous. Their blood group is O+. Why did I mention the blood group؟ لأنه عندها hyperbilirubinemia. ممكن تكون ABO incompatibility. ممكن تكون RH incompatibility as well. The father had a neonatal history of jaundice and blood exchange transfusion. Everything else was normal ما عدا her history of hyperbilirubinemia. So what can cause what are the causes of severe indirect hyperbilirubinemia؟ واحدة من الأسباب هي واحدة من أنواع الإنبورن error of metabolism، هي الكلاسيك galactosemia. طبعا الجلاكتوسيميا أنواع، هي مشكلة في الميتابوليزم حق الجلاكتوز، هي أنواع، هو طبعا من أنواع السكريات المعقدة وليست البسيطة. طبعا it's not a simple glucose. الجلاكتوز أو الجلاكتوسيميا أنواع. أسوأ نوع من أنواع الجلاكتوسيميا هي الكلاسيك galactosemia. It's an autosomal recessive disease. It's a defect in the galactose 1-phosphate uridyl transferase enzyme. وهذا الإنزيم مسؤول عن تحويل الجلاكتوز 1-phosphate إلى جلوكوز. أنا عشان أقدر أستفيد منه وأقدر أنتج طاقة أحتاج أحوله إلى جلوكوز. So if we are missing هذا الإنزيم ما حنقدر نحول الجلاكتوز هذا اللي هو الجلاكتوز 1-phosphate إلى جلوكوز. فذات's the deficiency. فعشان كذا هذا النوع من السكر راح يتجمع في الجسم فيصير عندهم accumulation of the galactose 1-phosphate. What are the clinical features of classic galactosemia? So بما أن المشكلة هي في الجلاكتوز معناته هي المشكلة الأساسية حتبدأ بمجرد ما الطفل ياخذ البريست فيدنج. ليش؟ البريست فيد الميلك فيه له لاكتوز. اللاكتوز يتكون من إيش؟ اللاكتوز عبارة عن جلاكتوز وعبارة عن جلوكوز. أي حاجة فيها جلاكتوز أول ما ياخذها الطفل الجسم ما حيقدر يتعامل معاها، حتضل موجودة as galactose 1 phosphate في الجسم، حتتراكم هذه المادة السمية فتؤدي إلى حدوث هذا الكلاسيكال برزنتيشن حق الكلاسيكال galactosemia من poor feeding، لأنه الملك أساسا مزعج بالنسبة لهذا الطفل، failure to thrive, vomiting, diarrhea، لأنه زي ما احنا عارفين السكريات لما تتجمع في الجسم ما يقدر يمتصها أو الانتستين cannot absorb it، يؤدي إلى حدوث الدياري لأنه عنده osmotic effect. جوندس، راح يصير عندهم هيباتوميجالي، والهيباتوميجالي هذه مرة مهمة لأنه الجلاكتوز 1 phosphate is going to be toxic to the body، فبيؤدي إلى liver cirrhosis, liver failure، كل الفيتشر حق liver cirrhosis تحسين ستجماتا من clotting defect just will develop within weeks if left untreated, so it's very bad disease. إذا ما عالجنا الكلاسيك galactosemia we will end up having liver failure, liver cirrhosis, and the child can lose the liver and subsequently they can lose their life. Cataract, which is really important feature of the disease لأنه في الكلاسيك galactosemia حتتكون عندنا مادة اسمها اللي هي الجلاكتيتول. الجلاكتيكول يعتبر very toxic للآيس، فيسوي إلى كاتاراكت ويأثر على العين. هيصير عندهم cognitive impairment، راح يصير عندهم increased risk of E. coli sepsis، هذا الشيء مميز بالنسبة للكلاسيك galactosemia، وراح يصير عندهم hypoglycemia في الأخير، ما حيقدروا يحولوا الجلاكتوز إلى جلوكوز فيصير عندهم hypoglycemia، ما يقدروا يستفيدوا في تصنيع الطاقة. How to diagnose galactosemia؟ أول حاجة newborn screening test. It will show increased galactose 1 phosphate in the blood. الurine galactose level راح يكون مرتفع، والtotal serum bilirubin راح يكون عندهم indirect hyperbilirubinemia. What is the treatment؟ complete cessation of lactose. اللاكتوز لو قطعناه الطفل ما حيتضرر. في other alternative، أي حاجة فيها lactose، أي حاجة فيها galactose and lactose they have to be both completely eliminated from the child or the affected individual diet. That was about the classic galactosemia، واحدة من الانبورن error metabolism المرتبطة بشكل مباشر بالبريست ميلك. فلما يجيك الطفل نيونيت جت الأعراض عنده after breast milk feeding بهذا الشكل، know the context, you have to think about the classic galactosemia, because if you didn't think about it you will lose the liver of the child and losing their life. Moving on to another group of inborn error of metabolism, which is case 7. Okay, so here we have an infant. She is 7 months old. Her parents are consanguineous. She has been admitted for progressive abdominal distension, vomiting, lethargy for 4 months. She has been sick for this time. The past medical history, she had a similar complaint in the past, abdominal distension, vomiting, or lethargy. Her developmental was slightly delayed. There was يعني مو مرة developmental، يعني ما عندها مرة developmental delay، لكن features significant abdominal distension, vomiting, and lethargy. There was a family history of death of a cousin during infancy due to liver disease. So family history is positive، والمشكلة كانت بسبب liver disease، والpatient عندها abdominal distension, vomiting, and lethargy. On physical examination, which is very characteristic here, they have a rounded doll face, fatty cheeks, and protuberant abdomen. Weight is below the 10th percentile, so they have failure to thrive, and a length below the 5th, so she's kind of short and thin. Everything else was unremarkable except also for a massive and a firm hepatomegaly. The kidneys are not palpable. So, what are the features here؟ ما في مرة developmental delay زي ما ذكرناها سابقا في previous cases. There is an abdominal distension with a palpable and firm hepatomegaly. There is a vomiting, lethargy. There is the round doll face, which is the characteristic feature of the disease we'll be talking about, and fatty cheeks, and lethargy and vomiting. هذه كلها كل الفيتشرز هاي تأخذنا إلى one disease we call it Von Greek. Von Greek هو أحد أنواع الجلايكوجين storage disease. فالفون Greek disease ما يأثر على البريك داون of the substance ال previous cases تكلمنا عليها، لا، هنا يأثر على storage of the glycogen، بمعنى ان احنا ما حنستفيد من الجلايكوجين، هو موجود عندنا في الجسم بس ما نقدر نستخدمه، ما نقدر نعمل glycogenolysis because of what؟ هذا الأوتيزومال recessive disease راح يكون عندهم enzyme defect في الجلوكوز phosphatase deficiency, which is an important enzyme in the breakdown of the glycogen. فعشان كذا هذول individuals راح يصير عندهم accumulation of the glycogen and fat. Remember in the scenario كان عندهم fatty cheeks، مو بس الجلايكوجين اللي راح يتجمع، برضو الفات راح تتجمع في الليفر and the kidneys and the other body tissues, giving the other features in this disease. The clinical features hypoglycemia، لأن ما نقدر نستخدم الجلايكوجين بالأخص during exercising starvation، لما نبغى نستخدم الستورز، يعني احنا في البداية نستخدم السكريات الموجودة في الدم على طول جلوكوز، بس لما تنتهي هذه الفاست ريسورسز نحتاج شيء مختزن في الليفر اللي هو الجلايكوجين. هذول الاندفيدوالز ما حيقدروا يستخدموا الجلايكوجين في الجسم، عشان كذا يظهر عليهم الهايبوغليسيميا during the fasting, during starvation. That's why these individuals, no, do not let them to fast. Developmental delay, not really that much. Failure to thrive, bone marrow suppression, doll-like faces, and I will show you a picture how they look like. They actually look very cute, those kids. لما تشوفيهم very cute زي dolls مرة لطيفين, but their disease is never cute. Okay, with fatted cheeks and relatively thin extremities. Short stature, protuberant abdomen, xanthoma، لأن هم عندهم زي ما قلنا fat والaccumulate، so حيكون عندهم xanthoma، حيكون عندهم diarrhea، حيكون عندهم bleeding tendency with the frequent epistaxis. Remember, they will have bone marrow suppression, so they will have a chronic neutropenia, recurrent bacterial infections, and oral and intestinal mucosal ulcers. Remember, they have some sort of immune deficiency. الأطفال اللي يكون عندهم Von Greek disease. So هيكون عندهم elements of immune deficiency as well with the characteristic features they have. So this is the children with Von Greek disease. You can see their cheeks are fatty. وجههم يشبه الدمية بالضبط، كأنهم actually دمى. I have seen a case in real life of Von Greek and exactly they look like a doll. They have this fatty cheeks with protuberant abdomen زي بالضبط اللي في الصورة قاعدين نشوفها. So they look cute as I said, but their disease is not cute. The diagnosis of Von Greek, the definitive diagnosis هو clinical diagnosis. The definitive it can be done by liver biopsy لكن it's very invasive procedure، وغالبا حنسوي الاساي of the enzyme to look for the galactose أو عفوا glucose 6 phosphatase enzyme activity in the body. The treatment, I think we mentioned one of the things we have to do for those patients is not to allow them to fast. Do not allow a period of starvation. They have to be frequently feeds of complex carbs, and they cannot use the glycogen. So if they're fasting, if they are not eating, الجسم عشان يحصل على طاقة حيضطر يستخدم الجليكوجين، هذول ما يقدروا يستخدموا. Sucrose and lactose are often limited or avoided. في الأخير نحن ما حنقدر حتى نتعامل مع هذا، نتعامل مع الجلايكوجين، we just keep building up the glycogen in the body. Raw cornstarch between 6 months and 1 year of age should be given for those individuals. So العلاج, there is no cure, just control the diet. That's Von Greek disease. Moving on to case 8. Okay, so here we have a case of 1-year-old female. She had features of Ross class 3 heart failure at the age of 9 months. طفلة عمرها سنة عندها heart failure at the age of 9 months. Okay, heart failure ممكن الواحد يقول congenital heart disease. That's a very important thing to rule it out. مرة مهم إننا we rule it out. And she's having hepatomegaly. طيب برضو لما الواحد يكون عنده heart failure بيصير عندهم hepatomegaly. واحدة من الأعراض اللي جدا مهمة في الأطفال، بالأخص في الأطفال في البيدياتريك للهارت failure is hepatomegaly. This could be a case of congenital heart disease. Okay, but also it can be a type of one. يعني let's say we did investigations وما كان في congenital heart disease، ما كان في أحد الأنواع congenital heart disease اللي احنا عارفينها. لما يكون عندي الهارت is involved والliver is involved, one of it can be تأخذك إلى نوع معين من أنواع الانبورن error of metabolism اللي هو Pompe disease. I'm sure you have heard this name before in biochemistry. Pompe disease, it is also one of the type of glycogen storage disease. Actually, it is a lysosomal type of storage disease. هو الوحيد اللي يكون lysosomal. يكون تأثيره في at the level of the lysosomes. Okay. Inheritance, it's an autosomal recessive. The enzyme that is defective here is alpha glucosidase deficiency. والالفا glucosidase deficiency الانزيم هذا مسؤول عن ايش؟ مسؤول عن breakdown of a glycogen to glucose in the lysosomes. So we say it's the only storage disease that happen at the level of the lysosome. هو يأثر على breakdown of the glycogen to glucose at the level of the lysosomes. تبعا على ذلك راح يصير عندهم accumulation in the glycogen in the body. فدائما لما نتكلم عن storage disease في features كذا مميزة في storage disease. لما نتعامل مع glycogen storage disease, remember they can have hepatomegaly. So the patients اللي يكون عندهم Pompe disease, they will have hepatosplenomegaly, they will have hypertrophic cardiomyopathy. This is really important. هذه feature مميزة للPompe disease, heart involvement. Hypotonia, failure to thrive, macroglosia. الماكروغلوسيا هذه غالبا a feature of any storage disease. لما نتكلم عن storage disease, macroglosia غالبا حتكون موجودة. فهي ما هي distinctive feature للPompe disease وحسب، بل أيضا لكل storage disease تقريبا يكون عندهم macroglosia. فتساعدك إنك you narrow down differential. يعني مثلا عنده فينال كيتونيوريا ما راح يكون عندهم macroglosia. Okay, but that's a keyword that help you to know which kind of inborn error of metabolism you are dealing with. هذول البيشنت ما راح يكون عندهم hypoglycemia. البيشنت اللي يكون عندهم Pompe disease they will not have hypoglycemia. عكس البيشنت اللي عندهم Von Crick راح يكون عندهم hypoglycemia. So they are different. This is an algorithm. You can read it later on by yourselves and how to diagnose أو approaching Pompe disease. لازم يكون عندك good history، لازم يكون عندك good clinical examination. ممكن هناخذ CK level لأنه يأثر على مو فقط يأثر على مثلا الفان جريك ميل اللي موجودة في الليفر والكدنيز. البامبي disease الهارت المسلز. So we might measure CK level. ممكن نعمل MAG nerve conduction study نشوف respiratory function. يعني we try to do multiple exams to rule out and rule in, to rule out the differential, to try to know whether this is a Pompe disease or not. You can just يعني you can go and read this algorithm by yourselves because there's nothing يعني special about the diagnosis here. How do we treat? تقريبا this is I wouldn't say this is the only inborn error of metabolism اللي عنده enzyme replacement therapy, but from the examples we mentioned, it's the only one here is having an enzyme replacement therapy. We could have another diseases also they can have this is treated. بس هذه من few diseases اللي يكون عندها enzyme replacement therapy. It's not available in all countries. It will not be given to all patients. It has its own indication. يعتمد متى تشخص المرض على comorbidities عند الطفل. But there are multiple things we have to know before we give the enzyme replacement therapy for those children اللي يكون عندهم Pompe disease. So that was two examples على glycogen storage disease اللي هي الفان كريك والPompe disease. الPompe disease يختلف شوي عن الفان كريك بأنه at the level of the lysosomes. Let's move on to case 9, which is going to discuss different type or different group أساساً of glycogen أو عفواً of inborn error of metabolism. A very interesting group. So So we have here a 4-year-old boy. They have a limited movement of his fingers. Since ما هو انولد هو عنده مشكلة بحركة الأصابع، ممكن يكون عنده contracture. طيب. His mother found that he could not lift his arms to his head. So عنده مشكلة بحركة المفاصل، فعنده some sort of contracture. هذه الفيتشر الأولى. الفيتشر الثانية عنده coarse face. لما أقول coarse face على طول شيء معين will click in my mind. يعني هم مجموعة الأمراض الوحيدة في inborn error of metabolism اللي تؤدي إلى coarse face. Joint stiffness, we explained that in the presentation في البداية. Short stature, mental retardation. Okay. At birth قلت لك الأم كان طبيعي، فجأة بدت الأعراض تطلع عليه. فهذا يرجعنا لبداية الجزء الأول في المحاضرة، إنه قلنا بعض الأمراض at birth they are looking fine ويحتاجوا وقت to show up the disease features. واحدة منها هذه الأمراض اللي نتكلم عنها. His hand and feet were large, okay, and rather short. حجمها كبير لكنها قصيرة. Skeletal examination showed short stature with relatively short limbs. X-ray paddle-shaped widened ribs. وعنده mental retardation. فنلاحظ إنه الأعراض أكثر شيء مؤثرة على المسكولوسكليتال وعلى النيورو. فهذا collectively كلها مجموعة من الأمراض اللي يكون عندهم فيها coarse face. جروب كبير من مجموعة من الأمراض نسميها mucopolysaccharidosis. هي مجموعة من الديزيز اللي يكون في عندهم يعني مشكلة في الامينو او اللي هي الميوكوبوليساكرايدز in the body. It will accumulate in the body. It's an autosomal recessive. كل المجموعة هذه autosomal recessive ما عدا نوع واحد منه هو الهانتر disease X-linked. الإنزيم defect يعتمد على الأنواع. نحن we are going to discuss 4 types of the mucopolysaccharidosis. وكلهم يصير عندهم glucose aminoglycan accumulation أو نسميها mucopolysaccharides. وهذه المركبات وجودها غير صحي في الجسم. In general هذه clinical features in general لما تشوفيها تفكري بالmucopolysaccharidosis بعيدا عن نوع الميوكوبوليساكرايدوزز that we are discussing، لأنه هذا الجنرال feature بعدين كل نوع حيكون عنده كده distinctive feature خاصة فيه. أول شيء الفيتشر الأولى is progressive، يعني as the person is growing it will just get worse and worse. الفيتشر تخليني أعرف this is a mucopolysaccharidosis, this is not an organic acidemia, this is not a fatty acid oxidation disease. هي coarse features لما أشوفها أعرف إني قاعدة أتعامل مع mucopolysaccharidosis. هذه أكيد feature هذه الأمراض. فلما تشوف coarse features you can exclude مثلا من الخيارات الفينال كيتونيوريا, you can exclude maple syrup disease, you can exclude Vanek Greek they have a doll face, a very cute face. لا هذول حيكون عندهم coarse features. لما أقول coarse features حتشوفوها في الصورة. لما تشوفوا الصورة حتفهموا إيش يعني coarse feature. ملامح وجههم حادة، ملامح وجههم كبيرة، يعني تعطي ملامح إنسان بالغ في حجم في طفل صغير. فهذه الكويرس features. وممكن هذه حتى الكويرس feature نشوفها حاجة درسناها في الانترنال ميديسن، نشوفها في الادولتس الاكروميجالي. شفتوا الفيتشرز نقول لك عند المريض يصير عنده كويرس features، برضو هذول حيكون عندهم كويرس feature مرة يشبهوا بعض. thick eyebrows, organomegaly، كل شيء حيصير عندهم كبير ومتضخم في الميوكوبوليساكرايدوزز، انه اتس لايك تجمع سكريات فتضخم الشيء. joint contracture، السكريات زي العسل تخلي شيء يتلزق، فيصير عندهم contracture في الجوينت يتلزقوا، ويصير عندهم growth deceleration. Another feature also للmucopolysaccharidosis اللي هي deafness. They will have 2 types of deafness اللي هي sensorineural hearing loss والconductive hearing loss. راح يكون عندهم recurrent hernias، راح يكون عندهم thickened mucous membranes. They can also have cardiac involvement. They can have also hydrocephaly. They can have an obstructive airway disease. They can have a difficulty in intubation and excessive secretions. Remember, it is a mucopolysaccharidosis disease that can affect the musculoskeletal, so it can affect also the bone and the things that are involved in the formation of the airway. Another important features I highlighted لأنه distinct مو لأنه distinctive للميوكوبوليساكرايدوز. We can see it in other disease زي Down syndrome. They can have atlantoaxial instability. الناس اللي عندهم rheumatoid arthritis they can have atlantoaxial instability. But why I highlight this disease because of أو هذا الفيتشر because this is very dangerous. Atlanto instability is very dangerous. It can cause spinal cord injury. So if you have a patient عنده mucopolysaccharidosis and they simply presented with upper limb numbness, muscle weakness, you have to do MRI to rule out the cervical spine injury due to Atlanto instability. Odontoid hypoplasia and pulmonary and systematic hypertension as well. So these are general features of the mucopolysaccharidosis. This is a general approach to the disease. The same thing, we start with a screening urine test and then we do the confirmatory test بعد نحدد نوع الانزيم الديفكت عشان نعرف نوع الميوكوبولysaccharidosis اللي قاعدين نتعامل معه. These are the pictures showing you the clinical features of a mucopolysaccharidosis. The picture on the left of the boy and the picture of the girl, you can see the clearest features I have been talking about. You can see also contractures in this picture, and you can see also in the X-ray something we call dystosis multiplex. There are different types of mucopolysaccharidosis. We have 4 types of mucopolysaccharidosis. We have type 1 and we have type 2, type 3 and type 4. Each type I have put a picture that represent a feature مميزة في هذا النوع. The first type هو الهيرلر disease, which can cause growth deceleration, can cause corneal clouding, it can cause a hepatosplenomegaly, it can cause pes cavus, and it can cause hirsutism. And the picture of that very famous character, it can represent that. This character is hairy, is short, their eyes is red, so we can tell there's an issue in their eyes, so corneal clouding, and their feet look weird, so we can say pes cavus. So this is the first type of mucopolysaccharidosis. هذه الأشياء تميزها. ركزوا على corneal clouding. النوع الثاني هو hunter type 2. I put this elf, I said skeletal anomalies because they are taller than humans and they are thinner than humans and like larger. They have different body habitus than the humans, so they have the skeletal anomalies. It's called hunter and it's an elf. They have good vision, so there is no clouding of the cornea. Then we have Sanfilippo, which is type 3. أكثر شيء يميز هذا النوع من الميوكوبولysaccharidosis, it's the behavioral problems, and that's why I put the character of Mad Hatter, which is having that kind of very interesting personalities. So remember, it is with behavioral problems. The last type هو Mercu, type 4. I put a picture of a dwarf because they are short, they are wider, so skeletal involvement, they have a normal IQ as well. This is a very nice picture showing our schedule or table showing you the different types that we discussed of the mucopolysaccharidosis. All of them, they are autosomal recessive ما عدا الهunter, as we said previously, which is an X-linked. You can read it by yourself. It's very clear. It's very important as well. Treatment, some types of mucopolysaccharidosis, they can be treated by bone marrow transplant. They can be also with enzyme replacement therapy زي البومبي disease, but it has its own indications. The details of the treatment is not our topic in the Inborn area of metabolism, والهي التوبيك اللي discussed بالexams إلا في بعض الأنواع تقريبا first 6 cases. That's what we care about the treatment. The other type of diseases, treatment is not really important as much as the clinical features and the complication and presentation of these disorders and what is defected in those individuals. Last case. Okay. So here we have a 5 years old girl عندها a multiple history of episodes of hypoglycemia, features حق الهايبوغليسيميا, loss of consciousness إلى آخره. الأبكار سكور كان عندها 8 لما كانت neonate كانت عندها 8 after 16 hours of a labor. كانت spontaneous vaginal delivery. الهايبوغليسيميا والبروتوكول started when she was a child. Recovered لما أعطوها الفورمولا feeding. So distinctive thing here, she had multiple episodes of hypoglycemia. So she has an issues with energy production. Hyperbilirubinemia. She also had a hyperbilirubinemia. She had some sort of respiratory distress, but she didn't do any intubation. She also she remained asymptomatic and continued to meet the adequate milestones in the first 3 months of her life. Then she started to be hospitalized again for hypoglycemia. So the major issue here إنه عندها hypoglycemia. والشيء اللي دائما يأثر على الانرجي برودكشن one of the diseases نسميها الفاتي acid oxidation, لأن احنا عارفين especially لما نكون في مرحلة starvation نحتاج نكون الكيتونز عشان نعطي مصدر طاقة آخر غير الجلوكوز, نحتاج الفاتي acid ونعمل oxidation. These individuals they will have an issue in the oxidation of the fatty acid, فما نقدر نستخدم الفاتي acids وما نقدر نستفيد منها. So they are in autosomal recessive disorders. There are multiple enzymes will be defected here in those diseases. اللي هي MCAD, LCHAD and the VLCAD. The most important is to recognize the pattern حق الفاتي acid oxidation. أهم إننا نعرف إيش الأنزيم defected. So what are the clinical features of fatty acid oxidation? Usually the baby زي ما شفنا في السؤال they will have multiple episodes of hypoglycemia. إيش نوع الهايبوغليسيميا هنا؟ نوع الهايبوغليسيميا هنا is a non-ketotic. Remember بالأورجانيك أسيديميا كانت كيتوتيك هايبوغليسيميا, لكن هنا في الفاتي أسيد أوكسيديشن إحنا عندنا مشكلة في الفاتي أسيد, ما حنقدر نكون الكيتونز فيصير عندهم نون كيتوتيك هايبوغليسيميا. حيكون عندهم برضو هاي أمونيا, حيكون عندهم هاي CK level, حيكون عندهم هاي CK level, liver involvement and cardiomegaly. They will have coagulopathy, sudden death, acute rhabdomyolysis, هذه مرة مميزة عندهم. Chronic weakness, راح يكون عندهم fatigue لأنهم they don't have energy. They will have lactic acidosis, حيتحولوا من aerobic to the anaerobic respiration in attempt to get the energy they need. الأم اللي تكون حامل بطفل عنده LCHAD deficiency, هذه الأم حيكون عندها ريسك إنه يصير عندها HELP syndrome, اللي هو ما يكونوا عندهم يكون عندهم low level of a platelet, حيكون عندهم elevated liver enzyme, فيكون that syndrome will happen in this mother, which is very dangerous, very risky. It can kill the mother if it was not treated. And if she is pregnant with that child, she will have the risk of getting this syndrome. Are the symptoms in the fatty acid oxidation triggered? Yes, the symptoms here are triggered by exercise. بمعنى غالبا they might not show symptoms. بعض الأنواع ما يكون عندهم أعراض إلا لما يبدأ يسوي رياضة أو يصوم. لما يبدأ الإنسان starving يسوي exercising بحيث إنه يحتاج يعمل fatty acid oxidation, يحتاج إلى مصدر هذا الطاقة, تبدأ الأعراض تطلع عنده. Yes, the symptoms they can be triggered in these individuals. This is an algorithm in how to approach fatty acid oxidation. As we said, the most important thing in this part is to remember how to recognize the pattern of the fatty acid oxidation. How do we treat these patients? The treatment of fatty acid oxidation will be by giving those individuals low fat formula. So these individuals لازم يتجنبوا الأشياء اللي تحتوي على فات, لأنه هم في الأخير ما حيقدروا يتخلصوا من الفات اللي موجودة في أو ما يقدروا يتعاملوا مع الفات اللي حتبدأ تطلع الفاتي أسيد وكذا بحيث إنه يحولوها إلى energy product. So this is mainly how do we treat fatty acid oxidation. So how do we treat them in cases of emergency? And How do we treat them in cases of emergency? That will be your homework. Because also there is another homework for you in this lecture that will be the third part of the lecture. I wanted to search about it, but we'll talk about it when we conclude this lecture. So what are the complications of fatty acid oxidation? The complications will be encephalopathy, fatty liver disease, and sudden death. So, I say it, and I always appreciate self-learning. You will have two questions to solve as your own self-learning, and now you know how to recognize an inborn error of metabolism, what is the general picture of these diseases, how to be able to read الانبورن اير اوف ميتابوليزم. ايش النقاط المهمه لازم نعرفها في كل انبورن اير اوف ميتابوليزم؟ اهم شيء نعرف التريتمنت والانزيم ديفكتد والclinical presentation of these diseases. You use this approach, you'll be able to study الانبورن اير اوف ميتابوليزم very easily. كل disease highlight الكي وورد الكي انفورميشن الصفات المميزه في كل مرض لانه باقي الصفات تتشابه فيها. So your homework is how to treat fatty acid oxidation defects in emergencies when they present you in the emergency, and what is metabolic crisis? What is metabolic crisis? So this is the inborn error of metabolism. I hope it was a very, very interesting lecture that you have learned a lot from it. And I appreciate your time by listening to this lecture. I wish you all the best. Thank you.